Unexplained fatigue or subtle changes in your body could be more than just everyday stress. Many early signs of diabetes in women are often overlooked. In this video, we'll discuss one of the most common indicators of diabetes and why recognizing these signs early is crucial for better health. Let's dive in. Polycystic ovary syndrome. Polycystic ovary syndrome is a hormonal disorder that mainly affects women of childbearing age. It often disrupts menstrual cycles and leads to excessive facial and body hair growth due to increased male hormone levels. But here's the connection to diabetes: many women with this disorder also have insulin resistance, meaning their cells don't respond well to insulin. To compensate, the body produces more insulin, which, in turn, stimulates the ovaries to release even more male hormones. This insulin imbalance raises the risk of developing type 2 diabetes. So, for women with polycystic ovary syndrome, managing both conditions is essential, and staying aware of diabetes risks is key. Frequent yeast infections. Recurring yeast infections may be more than just a minor annoyance. Yeast thrives on sugar, and when blood sugar levels are consistently high, as seen in diabetes, excess sugar can also accumulate in the vaginal area, creating the ideal environment for yeast growth. Women with high blood sugar often experience frequent and persistent yeast infections that may be difficult to treat. While not every yeast infection signals diabetes, recurrent episodes should prompt a closer look at blood sugar levels and a visit to a healthcare provider. Urinary tract infections, UTIs. UTIs are common in women, but frequent or stubborn infections may indicate elevated blood sugar levels. High glucose in urine provides a perfect breeding ground for bacteria, increasing the risk of infections in the urinary tract. For women with diabetes or chronically high blood sugar, this often leads to recurring UTIs or infections that take longer to heal. While UTIs alone don't confirm diabetes, repeated infections could be a warning sign that it's time to get blood sugar levels checked. Skin changes. Subtle skin changes may be an early clue of diabetes. One noticeable sign is acanthosis nigricans, which appears as dark, velvety patches in areas like the armpits, neck, and groin. This condition is strongly linked to insulin resistance, where the body produces extra insulin in an attempt to compensate for poor insulin function. Excess insulin triggers skin cell growth, resulting in these patches. While skin changes alone don't diagnose diabetes, they can be an early warning sign, especially when combined with other symptoms. Numbness or tingling sensations. A loss of sensation in the hands and feet, often felt as tingling, numbness, or pain, may signal neuropathy, a type of nerve damage caused by prolonged high blood sugar levels. Diabetes is a leading cause of nerve damage, which can make it harder to feel temperature changes, injuries, or infections, especially in the feet. If you experience persistent tingling or numbness, it's crucial to seek medical attention. Early detection and treatment can help prevent further nerve damage and complications. Persistent fatigue. Chronic fatigue isn't always due to a busy schedule or lack of sleep, it can also be a sign of poor blood sugar regulation. When blood sugar levels are too high, the body struggles to deliver glucose, energy, to cells effectively. As a result, women with diabetes may feel exhausted even after a full night's rest. If unexplained fatigue persists alongside other symptoms, it could be a sign of undiagnosed diabetes and should not be ignored. Blurred vision. Sudden changes in vision, such as blurriness that comes and goes, can be an early indicator of diabetes. High blood sugar can pull fluid from the eye's tissues, temporarily altering the shape of the lens, which affects focus. This can cause vision to fluctuate throughout the day. While this blurriness is reversible once blood sugar stabilizes, it's an important sign to take seriously. If vision issues persist, a blood sugar test and medical evaluation are recommended. Frequent urination. Frequent trips to the bathroom, especially at night, can be an early warning sign of diabetes. When blood sugar levels are high, the kidneys work harder to remove excess glucose from the bloodstream. When they can't keep up, the excess sugar is excreted through urine, pulling fluids from surrounding tissues and leading to dehydration and increased thirst. This creates a cycle: more thirst, more drinking, more urination. If you notice excessive urination paired with constant thirst, it may be time to check your blood sugar levels. Recognizing these warning signs early is critical for effective diabetes management and preventing serious complications. Women experiencing these symptoms should consult a healthcare professional for a proper evaluation. Early intervention can help. Managing blood sugar levels through diet, exercise, and medical treatment can significantly improve long-term health outcomes.
If you find this information helpful, please hit the like button and subscribe to our channel for more informative content.